Hey guys, so I wanted to do a video about my experience with LASIK surgery. I got it done about a year ago now. First of all, I'm going to start off with my background. I've been wearing hard contact lens since I was in second grade, and I've been wearing hard contact lens for about 20 years. And then 3 years ago, I switched over to soft lenses because I felt like hard lenses, it was like causing a lot of friction under my eyes, and it was making my eyes like kind of more droopy. So I switched over to soft lenses, but turns out my eyes are allergic to silicone, and there's a lot of soft lenses that I couldn't wear because of that. And the type of soft lenses that I could wear, they were kind of drying for my eyes, and especially since I was working at the office, it just wasn't really comfortable to wear it all day. So I wanted to look into getting LASIK done. So the first thing is you have to go in for LASIK evaluation, and prior to your LASIK evaluation, you have to not wear your soft contact lens for about 10 days. This is what it was for my doctor. I think every place is different. For hard lenses, it was about a month. And the reason being is because like when you wear lenses, it flattens your cornea. So that's not what your original cornea shape is like, and so they want it to go back to what it is naturally. Oh, one other thing is you have to make sure that your prescription is already stabilized before you go into doing LASIK, because it would suck if you got LASIK surgery done and then, your vision fluctuates. So if you want to get LASIK done, not all patients are good candidates for LASIK. You have to basically do these like eye exams and special tests, and these eye exams, like I know one of them is to like see the thickness of your cornea, if it's thick enough, like the eye pressure, seeing how healthy your eye is, like the amount of fluid in your eyes so that you don't have dry eyes. And it takes about like 2 to 3 hours just for the LASIK evaluation alone. And during that appointment, I think you have to wait for like maybe 10 minutes, and then the doctor tells you your result and determines if you are a viable candidate for LASIK. So in my case, obviously, I was a viable candidate for LASIK surgery, and the price of my LASIK surgery was $2,400. I had astigmatism in both eyes, and my prescription was -6. And I know if your prescription is like too high, they can't perform the surgery for your eyes. So again, this is why you have to do the eye exams and like the whole screening process to see if you're a viable candidate. So I know LASIK surgery sounds really scary because like it's dealing with your eyes, you don't want to go blind or anything. And when I read all these like online stories, I was like pretty terrified. But after speaking with the doctor, like a lot of my questions were answered and I felt a lot more like assured. And the main thing I feel like why there are errors in some LASIK surgery performed is because these patients weren't good candidates for LASIK surgery. And I think one key thing that's really, really important for LASIK surgery is to go to a good doctor, a doctor that's been performing LASIK surgery for many, many years. So the doctor that I went to, he's been doing LASIK surgery for about 20 years. And what he told me is that the accuracy of the laser performing your surgery makes the risk of the surgery itself really, really low actually, which I mean it makes sense because it's not like him using his hand trying to do like a physical cut. It's basically a machine that shoots out laser and reshapes your cornea. I feel like most of the errors is because some candidates, they're not meant to do LASIK surgery. So you might think like, oh, so it doesn't really matter what doctor I go to, but that's actually false because you want to go to a good doctor that can accurately determine if you can even get LASIK surgery done, because I feel like that is where maybe some doctors like do not pick the right candidates, and that's why some people might get extremely dry eyes after LASIK surgery, or their vision isn't like precise and it's actually worse than what it was, stuff like that. It's because of like the actual screening process. I feel like they didn't do a good enough job. And the thing that I was most scared about getting LASIK surgery done is like the risks. Obviously, I don't think it's worth, getting this surgery done if there's even like the slightest chance of me going blind or anything like that. My doctor personally, yeah, never had a case of making someone go blind, or even the bad cases that he had was extremely low for having done it for 20 years. Like he never had any lawsuit or anything like that. And as he said, it's because LASIK surgery is actually extremely accurate. Long story short, LASIK surgery is very, very safe. It's not something like doing brain surgery where the outcome is very unpredictable. So one side effect that he did tell me is that generally your eyes will be a little bit more dry than before surgery. And I mean, although my concern was dry eyes, like I told him I was getting dry eyes because of contact lens, specifically soft lenses, and he told me that if you can handle wearing like contact lens, then like your eyes should be fine in terms of like the dryness level after getting LASIK surgery done. Like it's definitely way worse wearing contact lens for like 8 hours. The doctor also informed me was that there's a 10% chance that your vision isn't gonna be where you want it to be, like within the 1 year span of getting your LASIK surgery done. And so within that 1 year after getting your LASIK surgery, he performs a second surgery, you know, for free, just to correct that vision, because it's like an estimation. Like they try their best to get it as exact as possible, but sometimes, you know, patient vision might regress, and so they have to recorrect it. And for my doctor, the price was already included in case like an insurance if they need to do that second surgery. I was told, I think most doctors, they do that. Prior to the surgery, he also told me that I needed to be well rested or else they can't perform the surgery on you, because your eyes need to not be dry basically, so it needs to have enough fluids. So make sure to sleep a lot before your surgery. The actual procedure took about 15-20 minutes. In my case, I ran into like a little complication, I guess, during surgery. The doctor said since my eyes, like the skin was so tight, he couldn't extend my eye wide enough, and so he had to use a scissor and cut the very like outer corner of my eyes, like right here. And it was really painful. I ended up actually having like a bruise that lasted for a month. Yeah, I was wearing sunglasses for 2 weeks, and then after the 2 weeks I used like makeup to cover it. For most people, I think it would be pretty easy breezy. But so in my case, because he had to cut the outer corner of my eye, there was definitely some lingering pain, and because of that I was like shaking on the table, and I was also shaking because I was really nervous. And because of that, the machine kept stopping. Like it senses motion so that it makes sure that it's supposed to zap where it needs to. Yeah, I'll actually explain the actual process of what's being done to you when you get LASIK surgery. So what they do is, here's like your cornea, and they cut a little flap, like a C-shaped flap, and then they lift the flap, and then they zap your cornea to reshape it. After that, when it's complete, they put the flap back down. And so whenever like it senses movement, it's not gonna hit the spot where it needs to like reshape your cornea. The doctor kept telling me to like stop shaking, and so I like held my breath to stop the shaking. Immediately after your surgery, you're actually supposed to take a nap, and I think they give you some sort of like medication to like fall asleep, because you're supposed to keep your eyes closed. Like your eyes are definitely blurry after surgery, so you need to find it right. After you're home, you're supposed to like sleep for a couple hours and then try to keep your eyes closed as much as possible for the first 24 hours. And then the day after surgery, your vision gets a lot better. Like you can completely function just fine. It just looks a little bit foggy. And if you go outside, I think for the first week after LASIK surgery, you're supposed to be wearing sunglasses to like protect your eyes from light, since you still have some like light sensitivity. So after they put the flap back down from performing surgery, that flap doesn't ever completely heal 100%. So if you were to perform surgery on your eyes again for LASIK, what they would do is just lift that flap. And I know it seems a little scary, like getting that flap dislocated, but my doctor actually told me that the chances of it being dislocated is like very rare, especially for those people that have gotten it dislocated. It's because like the first month after surgery, like they got into a fight, they got punched in the eye or something, and so it moved. But outside of that, it's pretty hard to dislocate the actual flap. Your vision is going to continue improving for the first 3 months, and most of that improvement happens in the first week after surgery. I think about like 90% improvement to what it's supposed to be. So for the first 2 weeks after surgery, you can't wear eye makeup, and the first 4 weeks after surgery, you can't wear mascara. So basically, plan accordingly so that you don't have any special occasions or like big events coming up. Another thing that is also very important after surgery is to not rub your eyes. I think he said if there's stuff in it, you would have to use like a Q-tip and then just get it on the inner corner of your eyes. But yeah, so don't rub your eyes no matter what, because you don't want to dislocate that flap like I was saying. And it's very crucial, I think, for the first month after surgery to make sure that that flap heals perfectly like where it's supposed to be and that there's no wrinkle. That's like a huge thing. You might not dislocate your flap, but you might wrinkle it. So you have to make sure that it heals properly. For the first 3 months after surgery, my night vision was pretty bad, and they already informed me that it would be like that, where you would see starbursts. I think like 2 weeks after surgery, I was driving on the highway at night with my boyfriend, and it basically looked like the movie Tron to me, with like the car lights. It would just like extend out, and it was pretty dangerous. Try to refrain from driving as much as you can, like after getting your LASIK surgery done, for the first 3 months. I think for every person it might be different, but just to be safe. They don't say that you can't drive at night, just you have to be careful. When they cut that C-shaped flap, they damaged some of the nerves of your eye, obviously, to cut that C shape, and because of that, it causes your eyes to be dry after you get LASIK. And so you're required to put on eye drops, I think, for the first couple weeks after surgery. In my case, I continued using eye drops morning and night, twice a day, for the first 6 months, I think, because my eyes were kind of dry, I'm not gonna lie. Not to the point that it was like unbearable, or like it wasn't worse than what it was when I wore soft lenses, but your eyes will for sure be dry. But now it's almost been a year, and I don't get any dryness problems at all. So one thing is that it does definitely get better because your eyes heal. After you get your LASIK surgery, my doctor told me that I couldn't wear color contacts until 1 year after my surgery, and it's been 1 year. That's why I'm wearing my gray contacts. Overall, I'm really happy about getting LASIK surgery. I feel like the upside of not having to wear contact lens or glasses ever in my life again, like, it's just really worth it. Obviously, maybe if like 10-20 years pass, like I would need to get my vision corrected again because it might regress, or you know, I might become farsighted or whatever, and that's a possibility. But I still think it's really worth it in that situation. Like if you had LASIK surgery done before, what my doctor told me is that they don't need to cut that flap again. It's actually even easier, the actual LASIK procedure, and what they would do is just lift that flap, correct your cornea again, and then they would just put the flap back down. So in my case, I actually ended up with 2015 vision, which is better than 2020 vision, and I only needed 1 surgery. I didn't need a second surgery, and my follow-up appointment actually is coming up. That basically sums up my LASIK surgery experience. If you have any questions, just leave a comment down below and I'll try my best to answer it. I'm sure I missed a couple things, so just ask and I'll try my best to answer it.